Good afternoon, everyone. Um, I'm waiting for a couple more people to trickle in, but while we wait for that, I'm going to do introductions. I'm Heidi, if you don't know me. I'm going to introduce Dr. Nassi. She is a pediatric rheumatologist with a board certification in pediatric rheumatology, and she's assistant professor in the Department of Pediatrics at University of Texas Southwestern. She's been on the faculty for 13 years. She treats children with rheumatic diseases at Texas Scottish Rite Hospital for Children and Children's Medical Center, Dallas. She received her undergraduate at Stanford University and then completed her residency and fellowship at the University of Texas Southwestern. We also have Alex Hernandez, I'm saying that correctly, and she is a nurse at Scottish Rites for Children, and they're going to talk to us about transitioning. I'm going to hand it over to them.
Okay, thank you for the introduction, and thank you guys so much for coming. And so we do have a little bit of a smaller group, so please feel free if at any point during the presentation, if you'd like to come up and ask questions in the middle, that is completely fine. And so I'm Lorien, Nassi, this is Alex, and today we're going to talk about rethinking medical transition. Early is better. And I do have my own little nod to the setting that we're in. So, given that we're in Orlando, I'm actually wearing a time turner. And for those of you that are not Harry Potter fans, the time turner is what one of the main characters uses to turn back time. So unfortunately, in this talk today, I do not have any secrets to turning back time for our children, but I am hopeful that today we're able to give you some guidance on how using the time that we have can be a little bit more useful and constructive and make the transition process a little bit less scary.
Our goals for today are going to be to answer the questions: what do we mean by transition? Why do we think it's important? How are we doing at this point? How can my medical team, what can they do to help us? What can my family do to be prepared? And then lastly, future research directions and hope for something better. Oh, yes, I'm sorry. So before we get into the meat of the presentation, we'd like to just take you down a trip through memory lane. I'm going to ask you to kind of do some visualization and really think back to your childhood. So think back to when you first learned how to ride a bike. Can you tell me, just answer to yourself, but who was it that taught you how to ride the bike? Was it a sister? Was it a friend? Was it your parent? And were you scared? Next question. How old were you when you first ordered your first meal at a restaurant? Were you 8? Were you 14? Were you excited? Were you nervous? You know, you wanted to let the server know what you wanted, and you want to make sure that they heard you. Were you asked to speak up? And the last question I'm going to ask is well, think back to your senior year in high school. What was your biggest worry at that time? Were you most concerned about your SAT scores? Were you concerned about the college application deadlines? Or was your biggest concern whether you should have a meal at a fancy restaurant during your prom night, or whether you should just go through the drive-thru at Burger King? So that last one, ask me if you want to know a funny story, ask me about that Burger King story a little bit later. But really, all in all, is throughout those wonderful periods of change and just really growing up, coming into your own, you always had someone there to hold your hand. You had someone there to show you how to do the thing, how to ask the question, how to get back up if you fell down from riding the bike, and how to try again. So in our presentation today, we want to invite the patients, we want to invite parents, we want to invite providers to just really work together down the journey of transition from pediatric care over to adult care, but really with that same respect that maybe you received or that you provided your kiddo when it came to riding the bike, ordering your own meal, having that autonomy of picking your place out for your senior dinner. And just so within our presentation, you'll see some numbers that are going to be coming up. You'll also get some resources and other things along those lines.
Okay, so I want to start off with some just basic definitions because I think a lot of the terms get used interchangeably and that's not quite correct. So in 2011, a consensus guidelines for transition from lots of different groups, right? So including the American Academy of Pediatrics, the American Academy of Family Physicians, as well as the American College of Physicians. So this is everything from pediatricians to family doctors to internal medicine physicians. They came up with overarching themes and again, just very specific guidelines. So first of all, transition planning. So what does that mean? So this means specifically engaging youth and their parents and their caregivers in assessing and developing self-care skills for an adult model of care at age 18. So transition is broad, right? So it means everything from being able to take your own medications to being able to take care of all of your needs, right? Whereas transfer of care specifically means assisting youth in identifying adult healthcare providers and ensuring that that transfer is smooth with updated medical records. So again, transition is the broader category, whereas transfer means the specific act of going to see the adult doctor. And then finally, integration into adult care. And so making sure that the young adult is oriented to the adult practice as well as the practice's approach, and then also just basically capable to offer ongoing self-care assessment and skills building. All right. So why is this important? It's important because it's actually a lot of people, right? So in the US, people that are aged 12 to 26 represent about 20% of the US population. And in fact, the number is 25 million are between the ages of 12 and 17. Of those, approximately 5 million have a special healthcare need, right? So this is a really profound, very large public health problem. And so young adults are particularly very vulnerable, right? So they have high rates of behavioral health risk, susceptibility to emerging or worsening chronic healthcare conditions, as well as low use of healthcare. And when you think about when you were in college, right, you didn't frequently go to see your doctor on a regular basis. This is something that is typically not a high priority for us when we were young adults. And in fact, when you actually ask young adults, many actually rank healthcare as a low priority compared to other things such as education, employment, housing, and relationships. So again, having health insurance and going to their doctor is not necessarily the first thing on their mind, right? Okay. So the question is how are we doing? So in 2016, there was actually a survey for parents of children ages 12 to 17. It was actually about 20,000. And so they were surveyed on 3 basic elements of transition. So basically the idea was discussing the shift to an adult provider and then actively working with the provider for self-care skills and understanding in healthcare at age 18, as well as did the provider spend time alone with you at the last visit? All right, so how did we do when parents were asked how we were doing? So unfortunately, less than half said that they saw a doctor who had discussed the shift to an adult healthcare provider. About 2/3 did have a physician that actively worked with them to gain self-care skills and understand the changes in healthcare at 18. So they did at least have someone that mentioned it to them. However, again, going back to the next question, less than half had had time spent alone with their doctor during their last visit. And then unfortunately, 17% had received all 3 elements. And so in general, this is something that we have not been doing super great. And so really, we start to do better once we start to say ages 15 through 17. But again, you know, surveys have shown us that we really need to start earlier because they need those tools earlier rather than later. All right. So why is this a problem? Well, it's pretty straightforward, right? So it's a problem because there are tremendous gaps in healthcare when appropriate transition skills are not obtained. First of all, they're at risk for non-adherence to medications. They're at risk for missed medical appointments, as well as significant medical complications, which can really result in poor healthcare outcomes, increased morbidity and mortality, dissatisfaction with care, and unfortunately increased utilization of emergency rooms and hospitalizations, and actually have some kind of scary statistics later on. And ultimately, all of this actually increases healthcare costs. So this is a huge issue, not just because patients do poorly, but it actually ends up also costing more money in the American public healthcare system. All right. So what are specific risk factors for transition difficulties for the adolescent? Number one, lack of access, right? So this is a time when a lot of people do lose insurance, and it is very, very difficult to get into an adult subspecialty physician. And so unfortunately, lack of access is a huge problem. The second is health status, right? And so if you have a specific healthcare problem, it makes it much more difficult for you to take care of yourself just overall, right? Not just specifically utilizing your own ability to take care of your appointments and medications and things like that. And then also developmentally, right? So an 18-year-old does not approach problems the same as a 40-year-old, right? Because again, the priorities are just profoundly different. And then just lack of knowledge, right? So a lot of times, I think as pediatricians, we do a much better job of talking to the parent rather than talking to the child, right? And so a lot of times, I think a lot of our education approaches are directed more to the parents than they are to the child, and the child oftentimes doesn't know all the things that they need to know to be independent. And then also beliefs and expectations. So I think in general, pediatricians tend to be a little bit more warm and fuzzy and a little bit more hand-holdy, and internists tend to be a little less so, right? And so I think a lot of people are intimidated about transitioning from a pediatric provider to an adult medical provider. And so I think there's just a lot of problems with the unknown, right? And then also support systems, right? So if you have a wonderful peer support or family support system, it's clearly much easier to have an effective transition than if you don't. And then also, so psychosocial risk. So again, late adolescence is a time of rapid change, right? A lot of times you're moving out of your house, you're graduating from high school, you're starting a new school, a new job. And again, it's just a lot that's happening all at once. And so that can be completely overwhelming for really anyone. All right. So what are some of the risk factors at the level of the institution? So this takes time, right? So education takes a lot of time and effort. And so a lot of times there's lack of funding and staff that really can make this happen. The other thing too is transition itself is not actually taught well in the pediatric residency program or any other fellowship program. It's not something that we're explicitly taught, right? We're taught which medications to use, what labs am I supposed to order. We're not really taught how to do education very well. And so then the other thing too is sort of the lack of an established transition protocol. So a lot of places just say like, well, you know, we're going to transition them at 18 and good luck, but there's not actually formal steps that are followed. And so really this is something that can be very profoundly helpful for programs. And then again, limited institutional support, right? So again, this is very costly, very time consuming, and it's not reimbursed by insurance companies, right? And so a lot of times there's some institutional barriers to implementing this into your practice because you can't do this in the context easily of a 15-minute clinic visit. And so the other thing too is providers, it's been shown, are really not very good at assessing how much our patients know. And so even sometimes when you think you're communicating something and you think you know something, when it's actually asked later, it turns out that we actually don't do as well as we think. And so really we need ways that we can do better. All right, so bringing up, so what can parents and healthcare professionals do to make this better? All right, so first of all, relationships and expectations. So it has really been shown that if the adolescents and their parents have interactions with the adult provider prior to the transfer, then the transfer oftentimes goes much better. Number one, they're less intimidated, they're already familiar with that person, and again, that can facilitate more trust, right? So then really the best way that's been shown is joint clinic visits, right? So seeing the pediatric provider and the adult provider in one setting so that you can see that familiarity and trust is established. And really ultimately having create a structured transition plan using individualized transition plan templates, right? So transition is not going to look the same for every patient. However, there should be core elements that will be necessary for everyone. The other thing that's been shown to be tremendously helpful is peer support, right? So having like an older patient who has already transitioned out of the system effectively can actually be a wonderful resource for those that are going through the process. And actually even things as simple as tours of the adult clinic, it's actually been shown that even if they've just seen the place before they go there, it can actually be very, very profoundly reassuring. So sometimes it doesn't necessarily have to be perfect. It can be actually something quite simple to make it actually a lot easier. All right, the next step, and I really think this is the most important one, right? So how to develop skills and build self-efficacy. So at the end of the day, practice makes perfect. And so this is why we urge people to start at age 12, not at age 15, doing self-care things. So the earlier you begin the transition preparation, the better. So if you start knowing what your medications and disease, problems are earlier, then you're have it just as by rote by the time that you're getting ready to transition. So education, right? So really, absolutely, it's upon us, it's our responsibility to provide information as how to effectively help transition, right? And so really teaching the kid to get used to being their own self-advocate, right? So particularly in the realm of pediatric rheumatology, a lot of times these kids have conditions that adult physicians are not even aware of their existence, right? And so I think just being able to be aware of your condition and being able to learn how to be vocal and being a self-advocate is absolutely key. As part of that, I think it's really important to encourage independent portions of the visit with the adolescent, the provider, right? Just so that they can get used to answering their own questions, answering their own medications, and just being able to interact with their provider and having that level of confidence and security is very useful in going to the adult world. The last one, and we're going to hopefully have a little bit of a show at the end of the presentation, is really to leverage technology, right? So you're not alone. So there are so many tools out there that are super useful. So apps, right? So it's easy to put it on your phone and just do it. So everything from medication adherence to symptom monitoring, as well as actually formal practice adult visits that can actually lead you through your first encounter with an adult provider are actually available. And so really there's a lot of tools out there that are profoundly useful, and we'll go through some of those later. All right. So what are things my pediatric clinic can do to help? So the first one is really formally, regularly assess and discuss transition readiness. So this is everything from just like your doctor saying to you like, hey, what medications do you take? How many of those pills are you taking? How much do you draw up on that syringe when you give it? You just basically understanding where that person is at. But there are also validated surveys, which we're going to go through in a minute too, that are very profoundly useful too. The other thing too is I think improving coordination of care between medical teams, ensuring that there's wonderful communication, right? So medical records and having a real deep understanding of the patient and the family that is being transitioned. It's really been shown that if you have a formal transition coordinator to check to make sure all of the transition steps are completed has been profoundly helpful in clinics, right? And so that ideally would be a trained social worker who can help patients and their families understand the financial changes that take place. But certainly it can really be anyone, just to make sure that the checklist is being progressed through. And so really at the end of the day, any kind of formal system or transition navigator that helps the young adults prepare for transitioning and giving them those tools is profoundly helpful. All right. So in 2018, actually, a new clinical report update came out, and it actually provided a lot more specificity as far as the goals that we should be meeting. And really it called for a structured transition process for all youth starting in early adolescence and continuing into a young adulthood. So what are they? And so really, this is all available online through one of our resources that we'll give to you. And so the first one is just making sure that there is a transition and or care policy. So having a policy and then discussing it with your patients is step one. And then formally tracking and monitoring their progress. And so there's great free validated tools that can help you do this. And then also just going on and continuing to do this and making sure that we're progressing in our ability to transition effectively and helping them plan and go through the steps in order to be integrated effectively into the adult world, ultimately with the goal of transferring care at the initial visit. After that, ideally, you'd like to obtain feedback to make sure that the transition has happened and that there are no concerns as far as any gaps in knowledge. But really, these are the basic steps that are urged. Then the adult side is pretty much just the converse, that making sure that you've received everything and are aware, and then communicating with the pediatric provider that we do have everything in place to move forward. All right, so I've been referencing this. So what were the time courses that they recommend? So again, it's really younger than you think, right? And in fact, they urge between ages of 12 and 14 are when you actually make the transition process and policy given to the family so that they're aware. And then between ages 14 and 18 is when you actually start to formally assess the transition process and seeing how they're ready. And then after that is more readiness. So practically speaking, what are they doing currently to manage their own healthcare needs? Then the 14 to 18 also, it becomes more formalized, right? So you start to develop a formal medical history and summary for the child to have with them upon transitioning. And then ages 18 to 21, that's usually when the transfer of care happens. And then after the transition is complete, in an ideal world, you would have communication with how effective that process works. All right, so this is clearly a lot of work that we're talking about. So is it worth it? So yes, so actually research has shown that really when we do all of these steps and we do them effectively, it increases visits to the new adult provider. It actually reduces the time lag between the last pediatric visit and the first adult visit. And so really there's less of a gap in their care. It actually improves adherence to care, improves health literacy, as well as people are happier, right? It all makes sense. And ultimately this actually leads to decreased ER and hospital visits, which is really, really the goal. All right, and just so you can see that I'm not making this up, there was this beautiful study that actually looked at 28 different studies and transitions, and really it showed that whenever families were given formal transition information, that there really was a moderate to strong improvement in these outcomes. Now, the next couple of slides, you do not need to look at in depth, but I just want to point out that unfortunately of the 28 studies that they reference, there's a whole lot in diabetes, lots of HIV, epilepsy, cancer, asthma, all kinds of things. There's unfortunately only one study in pediatric rheumatology. And so really there's still a lot of gaps in knowledge in pediatric rheumatology transitions. All right. So which brings up, I just kind of want to briefly mention some work that we've done at our center. And so we actually focus on our lupus patients because they're a much smaller group of patients and they're also profoundly ill, right? And so we asked, how did we do? Well, I can tell you, actually, even us, where we think we have a formal transition process and we really do all these steps, even we weren't doing very well. So unfortunately, out of 190 lupus patients we looked at, unfortunately, 11% of them went on to dialysis. None of those had significant kidney problems going into that process. And then unfortunately, there were some patients that even died. And it was shown that they actually did not have a rheumatology visit for 3 years from their pediatric visit. So these are people who had had the transition process, had a follow-up visit that was listed on the books, and somehow they still were missed. And so this says that even when you try and do everything right, unfortunately, things can go very wrong. So this brings up the question, how can we do better, right? All right, so what we did is we sort of at first just did an internal assessment where we did formal interviews with our pediatric rheumatologists, a couple of friendly adult rheumatologists, a couple of our nurses participated as well, one of our nurse practitioner, one social worker, and one psychologist. And I don't think this is surprising. They all said the same thing with, these are the core things that we can do to help. So the main themes identified, so the impact of the family, right? So people who have a strong social support network, that is often very helpful. So individual things, such as patient resilience and coping strategies, the role of mental health and emotional support, the need for health education, right? So we have to do better about making people aware of their own medical conditions, medications, et cetera. And it really emphasized the need for peer support and social connectedness. All right. So with that in mind, this other group actually showed, again, what the components of a successful transition program were. And no surprises, they highlighted the things that everyone else is saying. So really the written policy, individualized planning and flexibility and timing and the duration of the process, the presence of a formal transition coordinator, and then education as well as communication, and then programs that combine skill building, education, peer support, and a transition coordinator, i.e. having all of those different things are absolutely the most helpful. Okay, so what is the baseline at this point? All right, so we looked at about 882 patients that we had followed systematically, where we actually did the formal transition readiness assessment questionnaire, which I referenced earlier, which I'm going to show you, and then patient demographics to try and see if we could find any correlation. And so this is the assessment tool that I'm talking about. And so it's called the Track, and it's actually free and it's readily available. And so anyone can use this at any time. And so really it has everything from medication, self, ability. So like, can you do your own medications? Do you know what they are? To symptom monitoring, and then really all the way down to just basic life skills. Like, can you prepare your own food? Can you clean up after yourself? And so really it's kind of a broad, like self-care for the patient. All right, so in looking at the rheumatology clinic, no surprise, the vast majority of our patients were girl. We had a predominance of Caucasian patients. They're predominantly English speaking. And then again, juvenile arthritis, no surprise, made up the largest category. Okay, so again, as a reminder, we have a formal transition process that is automatically sent out to everyone at the age of 12. So it was asked by our families, had you received this? So again, they had received it automatically as part of the clinic visit. And unfortunately, even though it was automated, still the vast majority of our patients said that no, they had not received it. So we were not doing a good job of explaining what they were receiving. And then unfortunately, the second question, has your physician ever talked to you about transition? Again, the vast majority of people answered no to that question. And really, this was across all boundaries, right? So there was no link to diagnosis, insurance type, gender, race. And so really, unfortunately, the second one is a little bit even sadder. So we actually had about 120 patients who had done 2 different time points over a year. And there was actually no improvement over that year. So their transition readiness did not improve over a year's time. And so really, we're not doing a good job of helping people improve as they age. All right, so where do we go from here? So we developed a process where we are trying to formally do one-on-one transition planning in the context of the clinic session. So we did just a small pilot with approximately 20 patients where we did approximately 20-minute session where we basically went over some of our formal transition information. All right, and so basically this is just kind of an example of what we provide. And so this is our handout that we have been providing them on transition. And we actually just physically went through it with them during the clinic visit. And so it's basically just like being aware of your medications, being aware of your diagnosis, and then being aware of the different resources that are out there to help you. And so we ultimately also gave them these tools, sheets that they can keep track of their medications, as well as this way to keep track of their doctors as well as their numbers. And so basically just kind of hand-holding a little bit more and providing them and taking them through the tools that were available. And so after the session, people felt a lot better. So the vast majority of the people who actually went through the session did not feel it was a waste of their time. In fact, 83 to 94% of, depending upon where you're asking the patient or the parent, found it very useful. The vast majority felt that it was easy to understand, and also all of them would recommend it to other patients. And even after the one session, the vast majority said that they would still be interested in further sessions. And so really, I think that there is a hunger on the part of the families for this information. We just need to do better about providing it. And most of them did actually, because we were considering whether it'd be better to have an in-person format or virtual session. Then the vast majority did one in person. So this is just the follow-up questionnaire that we were asking. And so basically, do you think that we're doing a good job? Have we given you provided adequate information on the transition process? And have we given your child a chance to speak by themselves? But anyway, these were the final things that we did. So ultimately, our future plans, or we really want to start doing this with everybody, right? This is really the standard of care that we should be giving to everyone. So we really implemented transition care into practice and identify processes that are the most effective and formal measures to track success, right? Because clearly it's not enough to just say that you're doing it and handing it out. You have to actually see if the families are aware that they're receiving it and understanding what they're given. And we definitely need to broaden this out to all of our diagnoses and all of our patients. And I really do think that we need more information, right? So I think it's not enough to say, are we just doing this, but is this effective? Is this helpful for people? And so really having a formal process where we go back and ask people for feedback about how effective it was and look at, have you completed an adult physician clinic visit? Are you taking your own medications? Are you managing like all of your own healthcare needs? And so really this is going to take fostering collaborations across institutions, right? So I think that pediatric rheumatologists are very interested in this. I think adult physicians have sometimes been a little bit more difficult to get them engaged. And so I really think that we really need to try and build those bridges across both sides of that so that we can actually help in the future. And so really we just need to look at this much more systematically so that we can do better. So the challenges are clear, right? So it's difficult tracking adolescents across institutions, right? You have to have a very close relationship. And really there is a lack of validated tools by which to measure success. So I really think that we need to do better about developing tools to look at this. And then ultimately, time and money are ultimately like two huge hurdles for this. All right, so what are things that families and patients can do to make it easier? So really, there is a lot of help available, and this website is absolutely wonderful, the gottransition.org website, and actually a lot of the things from this talk are actually on that, available on that. And so really things from timelines for transition goals, there's questionnaires that are available for both patients and parents to assess transition readiness. And there's actually suggested questions to ask the pediatric provider prior to transition, as well as checklists for final transition steps, questions to ask the adult provider in practice prior to transition, and just really some of the expected differences between pediatric and adult care. And so I kind of wanted to go through some of the formal suggested timelines because I think that they're actually very useful. So again, starting young is key. So at age 12 to 13, we really would like for the patient to understand their own healthcare condition, what their medications are, if they have any severe allergies, as well as how to ask your own questions, right? So feeling free to ask questions and speak up during your provider's provider visit. And then also find out what age transfer is expected at, right? So just so you know how long you're going to be seen at your pediatric clinic. And then starting at age 14 is when it's really a good idea to start doing one of the formal transition readiness assessment questionnaires, just so you can see where things are at, so you can see where things need to be better. Really, the other thing too is to start carrying their own health insurance card, as well as numbers to carry and call in an emergency, right? So again, a lot of times at this age, there's more activities outside the family home, right? So they're spending more time at friends' houses, more time engaged in activities that are not necessarily with your family. And then this is a great time to start practice managing their own appointments and prescriptions, right? Can you refill your prescriptions? If you have a specialty medication that needs to be delivered to the house, do you know how to set that up? All of these things are not huge sounding, but practically speaking, every little thing can add up to a lot of problems, right? And then the other thing too is this is the time when it's a great time to start consider having a portion of the visit with the teen alone and with a provider to foster independence, just so that they get used to asking their own questions, having their own time to feel comfortable with advocating for themselves. All right. So 16 to 17, there is a reason this is bolded, have planned for insurance coverage, right? So the unfortunate reality of rheumatology is a lot of our medications and tests are very expensive. And so certainly just knowing what your coverage is going to be so that you can ensure ongoing care is really important. And so the problem is too, depending upon what the state you live in and what the state specific laws are, some of those times can be different. And so just being aware of the specific laws in your state, as well as the specific coverage for your insurance, okay? Then the other thing too is making their own appointments, actually calling and physically scheduling those and seeing the doctor alone and being able to refill the own medications. The other thing too is start working on the medical summary, like what medications have you been on before? Have you had problems with any medications, et cetera? And then just having kind of that in a nice, concise way. And then the other thing too is don't forget, a lot of our children have multiple physicians, right? That most of them at least have a rheumatologist and at least an ophthalmologist, and making sure what the time is for the different doctors, because it's not necessarily always the same. The next question too is, how long is it going to get to see the new adult provider? In our area, the average wait time to get into an adult rheumatology clinic can be about 6 to 9 months, right? And so it definitely takes a lot of time just to make sure that the person is not lost. All right. So 18 to 21, so 18, right? So parents will lose legal access to medical information unless the patient specifically provides them with permission. And so that's something that is really important. And then again, number 2, it's not exciting and it's not going to be foremost in the mind of someone who's a freshman in college, but plan on maintaining insurance coverage, right? That is absolutely key so that you can continue to receive the medications you need and get the labs that you need. Okay. So in summary, know where your readiness is at as a family, right? Just having some self-realization of where your child is at with the process. Do they know their own medications? Can they give themselves their own medications? Can they set up their own appointments? Can they log into their electronic medical record? All of those things. And so really it's important that they know their own medications, that they know their own symptoms, and that they're able to monitor those. And so really at the end of the day, the idea that they can practice self-care at home and at the doctor's office, right? So that they can be an advocate for themselves and take care of themselves well in the future. So really, independence early is something that is so key, because if it becomes just rote and habit forming, then by the time they move out, they really actually have it down. And so again, the plan for the adult provider and insurance really earlier than you think you need is necessary, because I think a lot of people think that they're going to be able to get in, they're going to have a referral at the end of their senior year and they're going to be seen before they go off to college. And that is just unfortunately not the reality most of the time. And so really ask questions. We love it when people ask questions and that people are engaged. And a lot of times, we need to seek expert help. So case managers, social workers can be profoundly helpful in navigating the intricacies of insurance policies, et cetera. And so with that, I think we have some time to see if some of these work. So I'm going to turn it back over to Alex.
All right, so you got excited when you saw in summary, right? But we're almost there. So the next few slides are going to be just a series of resources that you really could use to do some of the things that Dr. Nassi was just mentioning. Keep track of medications, keep track of appointments, do some further education besides what's given to you in clinic. So these are things that our young adults really can hone in on. So I have recently gone from paper checkbook keeping over to like electronic, and I'm way over 20, but it's taken a little bit for me to do that, and to trust the apps and so forth. So I've started to venture into some of these apps that are pretty important. Well, our kids that go into teens and then become young adults, this is what they do. This is their bread and butter. They're into the Google, the TikTok, all the other good stuff, right? So they can find apps on anything. There's an app for that, right? So there is an app for medication and healthcare tracking. And these are just a few examples. If you were to just Google search medication or health tracker, you can get like 200 of them. Honestly, I went this morning onto the sites and I said, I'm just going to pick one of these at random and see what we have. I keep my things on a very specific spot on my phone, and it's a very specific spot that I have to log into. It's just that no one that just has access to my phone can just open up and look. But I went ahead and did one of these apps just to see what that looked like. And I did the third one there, the MediSafe pill and med reminder. And I was actually kind of impressed by what was on there. I put in a random medication. After I put in the random medication and put in the dose, it actually produced a video that had a pharmacist speaking about the medication, about these are the ins and outs, right? So this is when you should take it. Should you take it with food? Should you take it without food 1 or 2 hours before or after? This is what it's called. It's called a non-steroidal anti-inflammatory. And these are the side effects that you should look for. So if we all know you guys are in a clinic visit and you're bombarded with all this information, where were you on the last visit when it came to the lab work? Where are you now? What's upcoming? Hopefully we ask about the young adult psychosocial items that are coming up. Are you traveling afar to another state and so forth? So these are all things that happen during a clinic visit, and sometimes you have the just information overload. So you can go home and access one of these apps and say, this is a new medication that is on my to-do list now, and access one of those videos. But of course, you always know that your physician's office and their staff should be very readily available to answer any questions. But on the side, our young adults may not want to pick up the phone and make that phone call. They can just use one of these apps to remember when to take a medication, record when they don't. So usually when I go into a room, I'll ask, hey, so what is usually about 13, 14 years of age, I'll say to our young adults, I'm going to ask you your medications, and I can help you a little bit, but do your best to see if you can remember what you take. And on occasion, I'll say you can phone a friend. You can look over to mom and see what they remember that you take. And of course, mom and dad always know, right? So the kiddo will sometimes say, I take the little pink pill, I take the little blue pill, or I take the white one. I take 3 of the white ones, and they're good about the colors, but they may not know what they are, which can get you into trouble if you have an emergency. So all that to say is those apps are great. These specific apps do, besides the video education, they also help you keep a record of who your physicians are. So your dermatologists, your ophthalmologists, and so forth. They also do an interaction checker. So sometimes with our medications, we tell our patients, so you shouldn't take this medication with this medication, but then on occasion, you may go home and forget what that was. And if you're about to take like an herbal medication or something along those lines, you can do that medication interaction check to see if it's okay for you to take both at the same time. The diary, the health tracker, that's really great because it actually gives you an opportunity to say like, hey, on this day, I had this happen. Like I just couldn't get out of bed. So that when you go to the doctor's office and our young adult has that time with the doctor, they can say, you know what, it's happening quite frequently. And the doctor says, okay, because we measure everything, right? How many times is quite frequently? You can say, well, let me look at my app. It looks like it happened twice in this last month, or is quite frequently, it's happened 20 out of the 30 days. So this gives you a much more better idea as to what your numbers are. The resources on the internet. So they're very, very important, right? You can find out everything on the internet. We often tell families, or we suggest to families, don't just Google and Wikipedia. Let that be your only source that you stop at. Because as we know, some of the websites, anyone can, chime in, change some information around, and whether that information is accurate or not, you kind of take your own risk. So there is a resource by the name of WebLit Legit. And this is an actual website that was produced because we noticed, well, the state of Texas commissioned this to say, like, we need something that speaks to patient safety when it comes to education, to things that are online. And so there's a group of people that got together and said, okay, we're going to increase the patient advocacy and education by putting this together and saying, this is how you decipher what's legit, what's appropriate, what's science-based information versus what's opinion. Can I trust it? Can I not? So this is the website. And as you scroll down, you see that there's specific information for children, there's specific information for teens, and there's specific information for older adults. So it's a great resource so that anyone who's maybe learning how to use the internet a little bit more, or really wanting to make sure that you are using the appropriate resources, and even our older adults, that they are actually looking at information that is appropriate and not just something that we put together. So then we have, thank you. So we've got a GOT transition. So we talked a lot about GOT transition. That's really one of the greatest resources that's out there. This is a resource that's placed by a combination of different hospitals, but it's also the CDC, it's also the government who said, hey, this is becoming a big thing, that there's intentional targets and goals that the government sets for everyone in healthcare, and they're called people 2010, people 2020, people 2030. So every 10 years, they set like these major goals to say, like, this is how we can better take care of our patients. And one of the things that was put out there for people 2020 is we need to do a better job for our teens, for our young adults, and getting them ready to move over to the adult healthcare. So there's a lot of different items that Dr. Nassi spoke about that are on here, and they're family toolkits. They're also like, hey, these are the guidelines that Dr. Nassi had up on her screen. Those are there. They also, the questions that you can ask your physician, your doctor at different periods of the time. There's specific PDFs or just a listing of the questions that you can access so that you can take those with you. So when we talk about having specific time, alone time with the young adult and the physician, it's not because they want to keep any kind of secrets from parents. It's really so that they can become comfortable with that conversation. So we talked a little bit when we started. We took a journey down memory lane, and I asked, when was the first time that you guys ordered your own meal? Were you 8 years old? Were you 14? And when you first did that, did mom and dad have to remind you to say, you have to tell her how many, or do you want your burger medium? Do you want it well done? They kind of had to guide you that way. But then at some point, you guys got to the point where you can order your own meal without their assistance. And that's the main point of trying to get that alone time with the young adult and the doctor in the room, so that they don't have that fear of, I'm going to the doctor's office and I'm not going to have mom next to me. I'll share a story about myself. When I was 19, I'd moved out of my home, my parents' home, that is, and I was sick. I was so sick I couldn't drive. I asked my mother to take me to the doctor's office. She did. And when I found out that I had to get an injection in my bottom, I said, can I have my mom come in and hold my hand? And they let her come in. That was the last time she came in to hold my hand to have something like that done. But I needed that extra little something. And so these are things that are running across our young adults' minds, that they just need a little extra little push. And the gottransition.com website is going to help you to even think about questions or situations that we may not have readily on our minds to work through. There's something called setting up the MedID feature in your Apple Health app, as well as an Android phone. So I'm not taking sides, whether you're Android or Apple. There is this tool, which is Medical ID, that's set there for in case of emergencies. So when you go to the gottransition.org website, it actually gives you a step-by-step on how to do that. So it has a lot of resources. I'm going to just go to really quickly to that gottransition.org website and show you. They have the 6 core elements, which was one of the slides that Dr. Nassi had on her presentation. You have specific information for the youth and young adults. You have information for parents and caregivers. You've got also resources and research. So if you're a numbers person, then that's your jam, and that's information that's readily available there. As you peruse it, there's just a lot of information there. You guys can take it a little bit at a time, or you can do it all in one sitting. I don't doubt that that's the case, but it's just one of those things that you can venture to and then use as one of your resources. We also have kidhealth.org. So kidhealth.org it's just really built amazingly. It's built by physicians and nurses in a specific hospital. I'm not going to name them, but you'll see it in our resources. And really, if you actually click on the link, it'll take you to their website. And I know that this is a national conference, so you guys, if you start exploring your hospital's website, and it may lead you from one hospital to another. It's not to say that, one information is correct versus another. It's just that they're all tied together to really work towards making sure that our young adults have what they need. And then all resources, we definitely do our best to share amongst the healthcare community. The kidhealth.org website has information on sleep, exercise, diet, stress, mental health. So those are all things that are super important. And, when you're young, you maybe not think about how much sleep you need, but it's really important. It also has information on health records and insurance. So I'm going to take you first to the general website for them, and then I'll take you last to the information on words about insurance, just because I found that really interesting and I thought that was important. So we'll go here first. This is the kidshealth.org website. And so you'll see it has information on healthy eating. It also has information on how to keep records and so forth. And then of course, just other HPV, COVID related information and so forth. So I pulled this specific thing out just because I really wanted to make sure that you guys really saw what I was talking about. It's a little on the smaller side, but these are terms that, you know, as adults, we may somewhat know, but then our kids definitely need some additional reading on. And those are things like words like co-insurance, co-payment, coverage limits, deductibles. What does it mean to have a deductible? Like what does it mean when you get to this? And to have all these questions thrown at our young adults when they're going into the adult healthcare world, all at the same time, it just is intimidating. And perhaps that's one of the reasons why they don't follow up with their adult doctors, because they don't know, and they don't want to feel like they don't know. So by giving them these resources, letting them explore these things, it's not one of those main things that they're going to make priority in their life, but just as we encourage, as parents, encourage our kids to try again, get up on that bike and try again. If you fell down, if you skinned your knee, that's okay. You try again. Next time you order that meal, remember to say please and thank you to the waitress, or tell them that you want decaf if they're drinking coffee versus caffeinated coffee, or as they're working through prom and they realize, hey, I have an opportunity to go to 2 proms because, you know, I'm dating a girl from that school, I'm dating a boy from that school, or what have you. You give them the resources that in the experience that you have had. We know that you give them the experiences that you have with healthcare, but again, these are other resources that you can tap into, because there's some things that we just may not know about how to better take care. And these are things that are really vetted. They're worked on by different groups of people who are really interested in making sure that these teams are very successful. And then lastly, I'm going to put in a plug for the Arthritis Foundation. You know, they have walks, they have things like this, the national conference, they have camps. So all those things, you know, you guys are making the amazing steps to making sure that your kids and yourself have the information that you need. But like the camps and the time that they're spending in individual rooms with different age groups, it's not just to keep them busy or to have them have fun. They're actually making connections. We take usually about 90 kids to camp in our hospital. And we hear stories when they're just having lunch, and we have one kiddo that will ask the other, well, I'm on methotrexate. What are you on? And how many pills do you take? Well, I take Self-Efficacy. How do you take it? Or what's your diagnosis again? You should know that. So like these are times that they're actually doing a lot of community building, peer building, making connections. They'll trade phone numbers, and then they'll have I'll say play dates, but they'll have just interactions between families that really will help them grow in their own healthcare. All right.
So that is it. So these are just some of the resources that we have referenced for your guys' awareness. But again, I think Alex went out and kind of detailed them very beautifully. And this is just like a thank you. So this is actually one of our fantastic fellows who has done a lot of the formal work at our institution in transition. And that is pretty much it. And so we do have exactly about 20 minutes left, actually not 20, 15 minutes left for questions. Are there any questions? Yes. So I don't think that I would necessarily put it on them as a responsibility. ability per se, but I would say that that's the age at which we try and start teaching, right? So I think from my perspective, a lot of our kids actually have decreased anxiety once they're more aware of their medications, once they're more aware of their own healthcare needs. I think a lot of it, if we can remove some of the mystery around why they're on this medication, why they're on that medication, then from my perspective, I feel like a lot of the information is actually helpful for the kid. I think it demystifies the process, and I feel like they have an element of control. Like, I'm choosing to take this because I want to be able to play soccer next season. Like, this is what this medicine does. This is how it's going to help me. And so, I think that from my standpoint, I think you can approach it from it perhaps increases their responsibility, but I think it also kind of frees them and like enables them to kind of help take control of their own health, And so I think that certainly developmentally, there are some kids who are not going to be ready for that necessarily. And some kids that are, right? So, I had an 8-year-old the other day in clinic who was giving himself his own etanercept shot, right? So I think that we can agree that that doesn't necessarily happen every day, but sometimes it does. And so I think that it's just, you do have to kind of meet the kid where they're at. And so if it's a kid that's really not ready to do that developmentally, then I think that you take that into consideration. And so these are just basic guidelines. And so obviously every transition plan is going to look different for the specific kid. But I do think for a lot of our kids, it actually helps ease their anxiety when they really understand the point of the medications and what they're there to do for them. Oh, I'm sorry? So I think the question is what are some tools that you can do to try and help the kid? I heard part of it, not necessarily all of it. If you want to use the mic at I'm sorry. And maybe Alex may have gotten more of it.
I didn't quite get all of it, so if you don't mind using the mic, but I did have a thought. So the 14, 15, that's like in the midst of all the hormones coming up, right? So I think that's why the policies, the plan, everything that literature says that we should start at 12 and 13, because usually at 12 and 13, you're not dealing with the same intensity of items that 15 and 16-year-olds are. So if you start at 12, 13, they're not seeing it as yet another new thing that they have to deal with and experience. You've already started the conversation. So it's just yet another visit with the doctor to say, okay, yeah, well, I already started doing or learning my medications and so forth. So it's just, you start outside of the window of all the intense subjects that they're having to deal with at 15 and 16. So 12 and 13 is our goal. And then you just continue on from that point.
So the other part of my question was that if you let them have that one-on-one time with their pediatric rheumatologist, then how do you not miss out on information that you need to be
you're right.
taking care of them and helping them remember?
100% is both, right? So it definitely, I think that that's a big part of the barrier is it lengthens the clinic visit, because we're not talking about how the kid's going to be deciding which biologic they take without their parent in the room, right? So, I think the point is that you have to have both for sure. So I think the idea is just a portion so that they can get used to giving their own history, identifying their own symptoms and asking their own questions. But 100% that was not meant that was going to be in lieu of the parent being in the room with the child, because it's absolutely that is ultimately the adults have to be involved in making the decisions at the end of the day. Yeah.
Forgive me if this is a little too far into time, but as a parent with a child that's 16 looking into college and that sort of thing, and going into college somewhere else in the country,
Yep.
How do you start to develop that transition program with doctors in another part of the country you haven't even identified yet? And two, how do you, once you figure them out, how do you create that transition plan on a very short time frame now?
Yep. Yeah. So the reality of this is you're absolutely 100% correct, right? So and I have this conversation. And so my transition so we say 18 is part of our transition policy, but definitely I follow kids all the way through their senior year of high school. And I tell them early on, and depending upon what the diagnosis is and the complexity of it, I will have an honest conversation with, like, I don't necessarily care which part of the country you go to, but I would urge you to think about going to a university that is in a major city by a major medical center, right? So just having that honest point blank, like, I don't think that you need to be out in the middle of nowhere if you're going to have a flare of your systemic arthritis. You know what I mean? So I think, and again, that's a little bit more of a dramatic example, but I do have that honest conversation that I think that a city with a major medical center is probably a good idea. And then what I do is then I have a visit pretty close to after they would be identifying which college they're going to be at. And then we start the transition process then. And then pragmatically, I try, it's hard sometimes with summer travel schedules that people have, try and book another final visit with me after that, right before they're going to be going off to college. And so at that date, then even if they haven't, then hopefully they have a date of the visit on file once they get to their college, right? So at that point, number one, we'll have transferred them, or sent the medical records to the facility at the prior visit. And then in between that visit and the next visit, they'll have been able to get an appointment date on the books. And so when I'm seeing them one final time to get one final set of labs, one final physical exam, they know exactly when their visit with the adult doctor is going to be, so that I can be sure that that network is in place. Yeah.
So I'll add that usually when those conversations start up and there is an identified school that someone is going to, or sometimes people will come to us with like, these are my top 3 schools. Who do you know in that area? So our physicians and our nursing group are amazing at really going to conferences, making sure that they educate themselves on any new state of the art.
Yeah, I just want to put in a little plug for the American College of Rheumatology network here. I think that they've done a great job of making sure that physicians in rheumatology in general are aware of other physicians in rheumatology. And so even though as pediatric rheumatologists, we kind of tend to stay in our small world, through that system, we're able to identify like other, academic rheumatologists that we can actually then get our patients into. And so it's a great resource as well.
And you see how excited we're getting over, we're fighting over the mic, right? But both of us have gone to American College of Rheumatology, to the ACR conference for years. And it's the networking. We make connections. Not only do the physicians make the connections and kind of get a better idea of like, can I trust that guy? Or that's probably a better physician on that side. The nursing group also does the same thing. And so we start speaking about like, what are the challenges that your group is facing, versus my group, and there's like networking that happens, and through that we build good relationships with nurses from all over the different groups. And I speak on the nursing side, physicians do the same thing, but that's how we make those connections to say, oh, so and so physician is there. But we also let our patients know, come to us with your top 3 school choices. Bring your health insurance card with you. We're going to set you up with an appointment with our social worker, because the other limiting factor is who is in your network. And so we connect our patient families with the social worker so that they can do a check. They'll say like, this is the zip code where they're potentially going to be at. We want every physician that's an adult rheumatologist within 20-mile radius. That list, then they bring that to us, to our physicians to look at. And so we typically will circle a few and say, contact these friends, see how long it takes to get in, and then make that appointment and do everything else that Dr. Nassi was just mentioning.
You're welcome. Good question. Yes. Sorry, this summer we're dealing with this question on a regular basis now. So it's a little close to home, as you can tell.
So my daughter just turned 18 last week. So she's definitely in a transition period. But someone told me to get power of attorney medically for her. So if she has to go in, because we've had trips where she comes in unconscious to the ER.
Yeah.
So is that necessary, and how do I do that?
Yes. So that is another great question. So again, I think for me, one thing that I'm truly blessed with at our institution, we have a wonderful social worker who helps. And so helps us navigate some of the medical legal aspects. And so definitely if you do if your child is medically complex sufficient that they're going to need help with that, then you are correct. Once they've turned 18, technically you do not have medical power, they do. And so there are wonderful family law people that can help lead you through that process. And there's actually, and it's not necessarily an all or nothing thing. There's different avenues that you can go down based upon your family's and the child and the patient's specific medical needs and developmental needs, et cetera.
And to add to that, some of the resources that were on the PowerPoint, I spoke about like just diet and so forth. There's actual resources within those websites that speak to that. When do you need to have that power of attorney and how do you go about doing it? They give you the foundation because of course, every state that you're in, laws are a little bit different, right? So, but it gives you a good starting point. So if you go to the Kids Health, the gottransition.com, you'll see specific tags that are addressed the question that you're asking.
Any questions online?
Any online questions?
No online questions at this time.
Okay, perfect. Anything else? Hope this was helpful. Great. Well, thank you guys so much for attending. And please, if there are any questions afterwards, feel free just to grab us. We'll stay around for a few minutes. Thank you guys for coming. Have a wonderful weekend. Enjoy Florida.